Hey guys, this is Marissa Quiones. I am the Class D pharmacist for the Collins Clinic, and today we are going to be doing an in-service on a medication called Liletta. Liletta is a levonorgestrel releasing intrauterine system. The initial date for U.S. approval from the FDA for norgestrel was in 1968. So the actual norgestrel has been around a long time, but it's now levonorgestrel in this intrauterine system. When you look at the different drugs that have Liletta as their intrauterine system, Liletta's overall dose of levonorgestrel is about 52 milligrams. Mirena has 52 milligrams as well. Kyleena has about 19.5 milligrams of levonorgestrel, and Skyla 13.5. As far as Liletta, it's about the same size as Mirena. Kyla is a 28 by 30 and Skyla is a 28 by 30 overall size in millimeters. And Liletta and Mirena are the same, 32 by 32. So a little bit bigger, but millimeters, we're talking millimeters. The approval for Liletta is 6 years, so it is the longest amount as far as approval duration of use. Mirena is 5 years, Kyleena is 5 years, and Skyla's 3. So a little bit of just kind of differences when you're thinking about the different intrauterine systems. So again, it is a sterile, it is a levonorgestrel releasing intrauterine system indicated for the prevention of pregnancy for up to 6 years. And the system should be replaced after 6 years if continued use is desired. The key features is that it's placed with a single-handed insertion. It has a locking mechanism with the cleft that keeps the threads in place and out of your way. And it also has a bendable tube to accommodate the anatomy of your patient during insertion. There's also color-coded sliders that assist in loading the intrauterine system and opening the arms in the uterus and releasing the IUS from the inserter. The device can also be repeated or reset, excuse me, for multiple repeated attempts if not loaded properly before you insert it. The initial dose is approximately 20 milligrams of the levonorgestrel per day, and it declines progressively to about 8.6 micrograms per day after 6 years. The Liletta can be removed anytime, but must be removed by the end of the 6th year, and it is to be inserted in the uterine cavity with a provider that's trained to do so, and also must be using a strict aseptic technique. Patients should also be re-examined and evaluated 4 to 6 weeks after insertion and once a year thereafter, or more frequently if clinically indicated. The dosage forms and strengths, again, it is the 52 milligrams. It's a T-shaped polyurethane frame with a drug reservoir that contains the 52 milligrams of levonorgestrel. There's several contraindications. You should have a sheet that I sent for you to have with some information. Obviously, pregnancy, if the patient's pregnant, there's some pretty easy ones there. If they've had an infected abortion in the past 3 months is another example. If they have some sort of acute pelvic inflammatory disease or endometriosis, if they have vaginitis or some sort of untreated acute cervicitis, or other genital urinary tract or tract infections. There's a whole list. I'm not going to list all of them, but you can review to your sheet for that information. As far as warnings and precautions, obviously if the patient gets pregnant, you're going to remove the device. And the patient, if pregnancy does occur, there is an increased risk for ectopic pregnancy. And that includes loss of fertility, pregnancy loss, septic abortion, and premature labor and delivery. Some other warnings and precautions are severe infection or sepsis, including group A streptococcal sepsis has been reported using this device. So that's why they recommend the strict aseptic technique for patients. There's a partial or complete expulsion that may occur. Evaluate persistent enlarged ovarian follicles or ovarian cysts. If bleeding patterns become altered or remain irregular, they may have amenorrhea. Some adverse events. Adverse events are usually reported in a different frequency, and so these are the ones that were reported in the most, in greater than 10% of users. This includes vulvovaginal mycotic infections, vaginal bacterial infections, acne, nausea, and vomiting. There is no drug interactions listed. And as far as patient education, we want to make sure that you keep a copy of the consent form and the Liletta lot number for your records, which we do in our pharmacy, and what patient gets what. So in case there is ever some FDA recall, then we'll know how we can track these patients by the records that we keep in the pharmacy. You want to counsel the patient on what to expect following the insertion of Liletta. Give her the patient information book, which includes the address, www.liletta.com, and that's Liletta. You want to discuss expected bleeding patterns of the use of Liletta, review the signs and symptoms of infection, perforation, and expulsion that can occur with Liletta. They may need to prescribe analgesics, maybe some Tylenol or ibuprofen. Make sure that the patient does return in 4 to 6 weeks to have an evaluation once a year right after, and then more frequently depending on what you think the patient needs. Removal is 6 years, or if the patient becomes pregnant or wants to become pregnant. And again, as we know, when it comes to birth control and intrauterine devices, is that they do not protect against STDs or AIDS or HIV. So it is important that they still use condoms so that the patients don't contract these other unwanted STDs and HIV issues. So with that, my name is Marissa. I'm the pharmacist. That's our in-service that we should do once a year, and it was time. I'll send, just make sure you sign in so that we get you credit, or not credit, but just so we document that we've done it. And if you have any questions, you can always email me, Marissa, marissa.quinones, QUINONES, @gmail.com. Or you can call me on my cell phone, 214-562-9429, if there's any questions, or you can email me the questions and I can get back to you. So I hope everyone's staying safe with the COVID-19, that you're washing your hands, not touching your face, and making sure you're screening your patients for no fever, shortness of breath, and cough. And hope that everyone is keeping themselves mentally sane and doing some sort of exercise or some sort of activities so that you're not overwhelmed and stressed at this time. So I hope everyone's doing well. Thank you for your time, and I look forward to seeing everyone in person soon.